Okay. Before we get started, you guys all remember how to dress your patient for the exam, correct? Any head work? You got to remove any false teeth, hearing aids, anything that can be removed. That would have to come out, okay? Everybody got that? If they're wearing a necklace, make sure they take that off. So what did we say that our facial bone routine is? PA Caldwell, a Waters, and a lateral. Generally, that's it. Now, they may do an SMV for what? Zygomatic arches as part of it. Usually that's not ordered, well, sometimes it can be, I won't say usually, but it may have a zygomatic arches ordered with it, okay? So, is this patient going to be too tall for this equipment? So you have to learn your limitations. So if it's going to be too tall, then what do we need to get? A chair. So let's just see if we can do it. We are not going to be able to do it, so we're going to need a chair. So you just wanted to sit down, right? So when you start your routine, you just want to do all the PA work that you can, and then spin them around for the AP if you have to. So we'll start with a PA Caldwell. Are we going to do a Waters for facial bones? Sometimes they do, right? So we'll go ahead and do a PA Caldwell, a Waters, PA, and then we'll do a lateral. We're only going to do one. Which side of your face hurts?
Right.
The right side. So we're going to do a left lateral, correct? No. We're going to do a right lateral.
Who nodded?
We're going to do a right lateral.
I was like, what? God, everything's so different.
And then we're going to go ahead and we'll have, if this was a spinning chair, we would turn the patient around. We'll do an SMV. Before we do that, we'll do the lateral, okay? So, Caldwell, Waters, lateral, turn around, SMV. Okay? So, where should my central ray exit?
Easy
Okay?
Is this clean?
I just cleaned it. Good new. It's been growing for a week. So, they're going to tilt their chin down, right? So the OML is perpendicular to the image receptor, and we're going to angle approximately 15 degrees bottle. Good. Go ahead and put your forehead. There you go. You want to make sure the OML is perpendicular. It wants to exit where? The nasion, not the acanthion. So let me look and align this up. Back just a hair. There you go. Go ahead, put your head back. Make sure that there's no tilt or rotation. Make sure our shielding is in place. Make sure you have a marker on there. Okay? Now, can I cone just a little bit? I sure can. So we're going to cone in just a little bit. Okay. Just a little bit inside. I'm going to bring this up just a hair. Actually, I think it's sliding down. So, okay, there you go. And what do you want to give them for breathing instructions? Just stop breathing, don't breathe. What happens if you tell somebody to take in a breath or hold your breath? Hold your breath. They're going to move. Yeah. So just hold still, don't breathe, don't move, make your exposure. What did we say our KVP was going to be set at? You can relax.
80.
Approximately 80 KVP, 40-inch SID. Any questions?
What about an adequate mass for that since you're penetrating?
It depends on your facility. I would say at least 20 mass. At least 20 mass for that. Maybe even, up to 30, depending on your KVP. If you go up to 85, then you can drop your mass down a little bit. Okay, so we're going to do the water.